Go Islanders! Good morning. It is a beautiful morning, isn't it? Let me acknowledge some of the guests who are here with us. First, Eric Quilliside, who is the Commissioner of Parks and is doing a great job. Michael Dowling, President and CEO of Northwell Health. Did you Northwell people know that Michael is going to be performing at Northwell Health? He actually sings a beautiful Irish ballad. Let's give him another round of applause. We have State Senator John Brooks, who's doing a great job. We have Matt Cohen, who's the new president of the Long Island Association, so congratulations to him. We have John Dorso representing the Brothers and Sisters of Organized Labor. Good to be with John. We have Suffolk County Presiding Officer Rob Calarco, who's doing a great job. Pleasure to be with Rob. And we have Suffolk County Legislator Jason Richburg. Pleasure to be with you. Thank you. I love coming to Jones Beach. Jones Beach brings back all sorts of memories for me. As a kid, this was it, Jones Beach, right? This was where we went during the summer. My grandparents used to take me. My father was doing whatever he was doing. You know those politicians, they work all the time, those people. But the choice would be Jones Beach or Sunken Meadow. That was the big choice. That was the variety where we would go. And I would come out as a kid with my grandparents and some of my sisters, and we would spend all day at the beach, just all day at the beach. I remember trying to explain this to my children, who are now 25, and they would say, well, what did you do when you were at the beach? I said, that was it, you were at the beach. You'd go into the water, you'd come back, you'd sit on the towel. Yeah, but what would you do? I said, that's it. That's what you did. You went into the water, you swam, you came back, and you played, you know. But think about it now. No telephone, no texting, no Instagram. So you sat there for 5, 6 hours, and you talked. You talked. And I was so close to my grandparents, I think partially because of that. You know, all the stories that they had a chance to tell, all the lessons they had a chance to tell. Different days. I remember thinking that the Jones Beach parking lots had to be the largest parking lots in the world. Remember when you would get a spot and then you'd have to walk all the way across? I didn't appreciate really the marvel that Jones Beach was as an accomplishment. I mean, think about it. Robert Moses, say what you will. Jones Beach, 7 miles of fill. Jones Beach, but there was no beach, right? It was all marsh. They filled 7 miles with 14 feet of fill to create Jones Beach, and then built those magnificent structures, right? If you proposed a project like that today, they would say it's impossible. Why did our ambition and confidence drop rather than increase? Think about it. Why were they so sure they could do it? The whole highway system that was going to come out, they believed in their capacity. They believed in what they could do. We need that back. Let me give you some facts and numbers on where we are today. Today, the positivity rate, really yesterday, the positivity rate, state of New York, was 1.09, okay? That's very, very low. To give you an idea of how low, 1.09, the national average was 2.6%, okay? So we are less than half of the national average. Give New Yorkers an applause, round of applause. You see in the numbers, and we've seen this all along, and we're going to have to study it at one point, but different regions in the state, different positivity rates all throughout the state. Why? One state, everybody gets the same message, same facts, same laws. Why do we have all these different positivity rates? Because it comes down to our behavior as individuals and our behavior as a community. You tell me how you act and what you do, and I'll tell you your likelihood of catching COVID. Tell me if you got vaccinated. Tell me what precautions you take. But you see a different rate all across the state. Finger Lakes, New York, highest positivity. Yesterday, 2.3%. Central New York, 1.5%. Western New York, 1.4%. Capital Region, 1.1. Mohawk Valley, 0.9. Mid-Hudson, 0.7. Long Island, 0.7. New York City, 0.69. Southern Tier, lowest in the state, 0.6. At one time, Southern Tier was one of the highest. And that message communicated. And the community changed its behavior. Statewide, 0.9%. Our 7-day positivity, 0.9, lowest level since September 21, 49 straight days of decline. Isn't that great news? Long Island, 7-day positivity, 0.7%, lowest since August 29th. So that's really great news. We hit over 10 million vaccinations done. 64% of New Yorkers now have at least one shot. Long Island, 69%, the highest in the state of New York. Just so we know it's not yet time to fully celebrate, some people want to say, well, COVID is over now. It's over. It's not over. It's managed. It's not over. 14 people passed away yesterday in the state of New York from COVID. And a troubling trend, the number of vaccinations is dropping off dramatically. We're now doing fewer than 100,000 per day. That's a dramatic decline, 55% decline in how many vaccines that we've been doing. So we have to make sure that this complicated message, we're managing COVID, we're doing well, the positivity rate, is not misunderstood to say it's over. It's not over. We are managing it by what we are doing. And the tool that manages it is the vaccination. And that is key to keep that vaccination going. But there's no doubt, on the other hand, that we are in a much different place in COVID. And we're on the beach, getting ready for Memorial Day. Seasons change, right? And the season has changed. The longest night eventually gives way to the dawn. And the coldest winter literally yields to the sun at the end of the day. And COVID has been a long, cold, dark winter. But the season has changed and we're on the right side. We have the beast contained, but we have to continue to contain the beast. Now, we're in the reopening phase. I talk to governors all day long. This year I'm chairman of the National Governors Association. And the governors are talking about we have to reopen, we have to reopen. Countries are talking about we have to reopen, reopen. I don't talk about reopen. Reopen suggests we're going to go back to where we were the day before COVID. We're going to reopen. We're going to go back to where we were the day before COVID. No. Life is not about going back. Life is about going forward. I don't want to go back to where we were the day before we started COVID. I want to go forward. I want to learn from this past year. I want to learn from the pain. I want to learn from the positive of what we've learned. and make sure that not only do we reopen, but that we reimagine New York. And we reimagine what we can be, and we build back better than we've ever been before. That's what we do. We seize the opportunity. What did we do after Hurricane Sandy? Nobody said, let's replace everything that was there. That wasn't our goal. We learned a lesson from Hurricane Sandy. We got knocked on our rear end. Open your eyes and learn from what happened and improve. There were homes that were wiped away, where I was there with the owners, crying, everything gone, their life gone. You go back to those homes today, they're elevated. Why? Because we learned. The electric grid was all underwater. Why? Because the transformers were on the ground. And the water came up, and all the transformers were submerged. Elevate the electric grid. Elevate the transformers. Get it out of the water. And that's the new electric system we have. And let's take a moment to say, what should we have done that we hadn't done? We just announced a new Bay Park treatment plant. Bay Park treatment plant was a problem for 15 years. It would get overwhelmed and drop everything into the channel. And now we have an entirely new treatment plant with a pipe that goes 3 miles out to the island, into the ocean. Why? Because you learn and you grow. And that's what we have to be doing here, and that's what we have to be doing now. We're off to a great start with our state budget, which we passed. It's on time. We got it done this session. But it does just that. It says, let's invest, let's learn, let's grow from this experience. Let's do the things that we should have been doing. Let's fix the Long Island Railroad, add that third track, make it a commute that is decent and safe and sound. Let's build a new Penn Station. Who wants to sit on the Long Island Railroad for 45 minutes to wind up in Penn Station, which is like the 7 levels of hell? What kind of way is that to start a day? So we're building a new Penn Station so the commute actually works. We've been talking about transferring to green energy for how long? How long have we been talking about renewables and getting away from fossil fuels? Do it now. New York State is embarking on the largest renewable energy project in the United States of America, in this state, on this island, with wind turbines and cables, bringing power to Long Island. So we are finally have a sustainable energy source that saves the planet. And understanding that people need economic relief. Taxes on the middle class are out of control. We cut taxes for the middle class in this budget. Finally, we cut middle class taxes. And we said to Washington, the worst tax we have in this state is what? It's not the state income tax, it's the property tax. Highest property taxes in the United States of America. Nassau, Westchester, Suffolk. Property taxes are higher than the income taxes in this state. And what did this federal government do over the past 4 years? They passed something called SALT, state and local tax deductibility. They ended the deductibility of state and local taxes. It was complicated, so they got away with it because people didn't really understand it. It basically raised your property taxes 30, 40, 50%. And we're saying now to the new administration, if you're actually going to repair the damage caused by the prior administration, start by repealing SALT and reducing our property taxes. It was a great budget, and I want to applaud Senator Brooks for his great work. You know, they say, we call it a budget. Budget diminishes what it is. It's really a whole action plan for the state. And to get it done, you have to have the Assembly pass it, you have to have the Senate pass it. That's over 200 people. To get 200 people to agree to anything is hard. To get 2 people to agree is hard. I'm divorced, I can say that. We now have, in New York State politics, we have a microcosm of the country. We have the most conservative conservatives in the country. We have extreme conservatives on one hand. And then we have the most liberal, not even liberal, we have socialists now. They call themselves socialists. So you have extreme conservatives on one side, you have socialists on the other side, and to get a budget passed, you have to find a way through the middle. And it is hard to do. And I'll tell you, Senator Brooks was a champion in getting it done. So, things are looking good. We're reimagining, we're rebuilding, but we have to maintain our containment of the beast, and that is the vaccines. And the vaccines are dropping off. 2 groups, the youthful and the doubtful. The youthful, because young people, really the way we introduced this was not a young person problem, right? It was introduced that if you're young, you may get it, but it's not going to kill you. Plus, you're young, you think you're a superhero anyway when you're young, right? Nothing can hurt you. When we started the vaccines, we said it was for older people, not younger people. So we introduced COVID saying young people don't have to worry about it. But young people do have to worry about it. They can get sick, and they can transmit it to someone without even knowing. So focusing on young people to get the vaccines, and then what I call the doubtful. Doubtful people who are doubtful of a vaccine. I don't like needles. I don't know that I need it. Government tells me to do it. I don't believe government about anything. And I'm nervous. I'm nervous about it. I don't know if it works. 10 million New Yorkers have taken it. It has been proven internationally. Almost every major medical official in the country will tell you, take the vaccine, it's safe. So those are the 2 groups we're targeting. And we're adding incentives. If you get a vaccine, you get a lottery ticket. Scratch-off ticket, you could win $5 million. When you take the Long Island Railroad, MTA, you get a free pass if you get a vaccine. To go to a baseball game, you can sit in a vaccinated area, you get more seating. You want to go see an Islanders game, better chance if you're vaccinated. And then, which is a reason in and of itself, they're going to win tonight, then they're going to come home and they're going to clinch the series at home in the Coliseum. So today we announce a new incentive, a shot in the park. You like that? Shot in the park? I didn't come up with that. As a matter of fact, whoever came up with that one. Shot in the park. Shot in the park is if you get a vaccine this week, anytime this week, you will get a 2-day family pass to any state park. B, if you come to a state park on Memorial Day weekend, if you get a shot when you come, Jones Beach is perfect. You're driving in. You have to go right past the vaccine center, stop, get a vaccine, you get a 2-day free pass to come into any state park. This is for all 16 parks across the state. State parks have been rejuvenated the way Jones Beach has. This is a new Jones Beach, and you should really take a look at it. But people have discovered our state parks, and I think partially our work rejuvenating them. Last year, 78 million people went to state parks, set a new record. On Long Island, 32 million people went to state parks. So we're going to use those state parks, use Memorial Day, enjoy the park, come, get a vaccine. We're going to set up a vaccine site at every one of the 16 state parks. Northwell is going to set up sites at all of the parks on Long Island. Right after Mike Dowling performs at the Northwell Theater, because first things first. Then they're going to set up their pop-up sites for all the state parks on Long Island. It's easy, it makes sense, it's smart, you don't have to go out of your way, and it is the right thing to do. My last point is this: it's Memorial Day, and we remember those who gave their lives on Memorial Day, gave their lives for this country, fought for freedom because freedom isn't free. I also think we should remember this past year on Memorial Day, remember the 42,000 New Yorkers who died. 42,000. Remember the 1,000 essential workers who died giving their life. Giving their life. Seasons change, but memories have to remain. Lessons have to remain. Remember how frightening COVID was when it started. Remember how frightened people were they wouldn't come out of their homes. Walk into a hospital during COVID, and it was like you were walking, landing on outer space. People covered with garb, head to toe, face shields. You couldn't even see a person's eyes or face. They wore name tags with pictures in the hospital, just so the patient could see some humanity. Nobody knew how it spread. Nobody knew how really it was transmitted. And you had people who showed up every day to fight that disease. It takes a special person to run into a fire to save someone. It takes a special person when every instinct in your body says, that's dangerous. Don't go there. Run away. It takes a special person to say, no, I'm going in because I think I can help someone. And the essential workers did that day after day after day after day. Every day, walking into the fire, not knowing, God forbid, am I getting infected? God forbid, am I getting infected? And then bringing it back home to my child. Nurses, doctors, hospital staff, teachers, food delivery workers, all these brave people, bus drivers, subway drivers. I stand up there every day and I say, stay home, be safe, stay home, don't go out, keep your kids home, stay in. But not you. You're an essential worker. You have to go to work tomorrow so everybody else can stay home. And they did. And they did. You want to talk about bravery, you want to talk about courage, you want to talk about selflessness. You want to talk about that question in your mind, what would you do if the circumstances asked you to really stand up and put your life on the line? What would you do? Would you stand up and run into the fire, or would you walk away? They walked into the fire every day. And we owe them a profound, profound thank you. We went from the highest infection rate on the globe in New York, on the globe, to the lowest infection rate, and we saved tens of thousands of lives because there are no people on this planet like the people of this state. And they showed their character and their strength and their courage and their unity. And remember them and their families on Memorial Day. Thank you, and God bless you. Let's give my friend and a real talk about an essential worker, talk about a hero. Michael Dowling's name is at the top of the list. Ladies and gentlemen, Michael Dowling.